I'm Dr. Jeanelle de Gruchy, and I'm Director of Public Health for Tameside. Over the last few weeks, Tameside's COVID rate has reduced slowly to a low of about 27 per 100,000 residents. However, as the restrictions eased from April the 12th, with shops reopening, restaurants and pubs serving outdoors, more people have been mixing, and unfortunately, we are now starting to see the rate rise again. So we now have 33 cases per 100,000 residents. And Tameside's rate has always been above the national average. So while we can all enjoy the new freedoms, which mean we are mixing more with others, I do ask you to please continue to be sensible, continue to be cautious. And I just want to go through the rules for you so that we're all clear on them. So first of all, please follow the rule of 6 or 2 households outdoors and stay socially distanced from other groups. Please don't socialise indoors with anyone you don't live with or haven't got a support bubble with. The council's enforcement teams have been out every day and they've been carrying out spot checks and generally just checking in with businesses. And they are saying that compliance with being COVID safe is generally very good. And I've no doubt that that is helping a great deal. But everyone still needs to remain cautious and make sure that they keep to those rules that are set out already. Also, please, it's still really important to keep up with your hand washing, wearing face coverings, and just generally keeping that social distance from others, trying to limit your contact with other people, and only meet outdoors where we know that fresh air reduces the very real risk of catching and spreading COVID to others. It's vital that we follow the national roadmap and its cautious easing of restrictions. Otherwise, there is a danger that when the national restrictions are relaxed further, Tameside could be left behind as the rest of the country enjoys greater freedoms. Now, unfortunately, there will be some of you who still get COVID despite all our efforts. Please get yourself tested if you have any symptoms such as a fever, new continuous cough, or loss or change of taste or smell. All Tameside residents can access free, regular, rapid coronavirus testing, and that's for people without symptoms. And we want you to be able to do that testing regularly to check whether you have the infection. The rapid lateral flow tests, they're quick, they're easy, and they give a result within half an hour. So to help all of us best protect each other, I recommend that everyone, even if you've had the vaccine, gets tested twice a week with the lateral flow tests. Home testing kits can be ordered online, or you can collect them from pharmacies throughout Tameside or from other venues within Tameside. And for any detail on how to get hold of some of these rapid tests, please visit www.tameside.gov.uk/rapid testing. And remember, if you do get a positive test result from these rapid tests, you do need to then do a PCR test to check your result. Now, more good news is that our COVID vaccine drive is continuing at pace, with more than 120,000 people having had their first jabs in Tameside, and 25,000 people have had their second dose. So our take-up of the vaccine in Tameside has been fantastic, and we now have more than 80% of people who are over 75 now having had both jabs, and so that means that they've got the maximum possible protection from the virus. Invitations are being sent to people who are in their 40s for vaccination now, and I'd urge people in these younger age groups to also take up your jab when offered, as the vaccine really is the best protection from becoming seriously ill or dying from COVID. or having long COVID, even at a younger age. Every single vaccine helps protect you and others and reduces transmission and the risk of variants. So all of this will help stop the spread of COVID and help us get back to normal. For those of you who are a bit worried about side effects, I'd like to reassure you that most of the side effects, if you have any at all, are mild and shouldn't last very long. So for example, a sore arm, feeling a bit tired, having a headache or high temperature may last for a day or two. Also, for those of you who are worried about anything more serious, a serious reaction, please be reassured that they are rare, and our staff giving the vaccine are trained to deal with any reactions and to treat them immediately. Thanks to everyone for your efforts in following the rules and getting vaccinated and tested to help protect our community.